Cervical spine consists of 7 vertebrae, that is C1 to C7, and is best evaluated on MRI using sagittal and axial plane. In sagittal view, we see overall alignment, whereas in axial, nerve root and foramina. Vertebral body appears rectangular or stacked in sagittal MRI image, and they are bright in T1, as we can see here. This is the vertebral body. These are the vertebral body, and they appear rectangular shape and bright in T1 and intermediate signal in T2. So this is due to the fatty marrow, as we can see here. This is the T2 and this one is the T1 image. In sagittal image, we have seen that the rectangular shape of the vertebral bodies, and in axial section we see this is the vertebral body and posterior elements, that is the pedicle, lamina, and these are the spinous process. So these are the important structure of vertebral body. So these are the anterior structures and these are the posterior elements. And these anterior and posterior element forms the central canal. This is the spinal canal and this structure is the spinal cord, and this surrounding bright area is the CSF. There are two special vertebra, that is the C1 atlas and C2 axis. So as we can see, this is the atlas, and this one is the axis. So C1 appears as it is a ring shaped structure, as we can see here. It is a ring shaped structure, whereas the C2 has the dense, that is this is the special structure, dense or odontoid process, and this articulate with the C1. So this is the odontoid process articulation with the C1. So C1 has a anterior arch, posterior arch, lateral masses. These are the transverse processes, and they don't have the vertebral body, and they also have the superior articular facet. They articulate with the occipital condyle, whereas they also have the inferior facet articulate with the superior articular facet of the axis or C2 vertebra. So intervertebral discs are the shock absorbing structure lies in between the each vertebra, that is these are the intervertebral discs. This is the T1 and T2. So its central part is nucleus pulposus, whereas the peripheral part is the annulus fibrosus. So peripheral is the annulus fibrosus and central is the nucleus pulposus. What we see in MRI, that is the hydrated intervertebral disc is bright or hyper intense in T2, as we can see here. These are the bright. So this is the nucleus pulposus, and if it loses its bright signal, so this is called the desiccated or degenerated disc. So for this degeneration, we must look for the T2 weighted image. Now another most critical structure is the spinal cord, CSF and thecal sac. So spinal cord is the critical structure that runs from the foramen magnum to the L1 vertebra. So this region is the foramen magnum. This is the foramen magnum. This is the foramen magnum, and it runs from the foramen magnum to L1, L2 level, and this is called the spinomedullary junction. And the spinal cord is oval shape in cervical region, as we can see in this axial image. So it is oval shape in axial image in cervical region, and it has the intermediate signal intensity in T1, as we can see. This is the T1 weighted image, and slightly bright in T2 and ester. So this is slightly bright as compared to the T1 in T2 and ester. So this is the normal anatomy. And thecal sac is the sac containing the CSF as well as the spinal cord. So it is the dura mater surrounding the CSF fluid within the spinal canal, and the CSF is high signal intensity in T2 and ester, whereas low signal intensity in T1, and it surrounds completely the spinal cord throughout its course. So what we look for? We must look for the cord compression and signal change of spinal cord. As we can see in this image, there is a signal change noted in spinal cord, and there is disc desiccation causing thecal sac indentation. Now the bony spinal canal. Normal cervical canal diameter is in sagittal image of MRI in AP dimension. At C1 level it should be 10.7 to 10 to 19 mm. At C3 level it should be 9 to 17 mm, and in C6 level it should be up to the 17 mm. So overall average is the 13.7 mm. If its diameter is 10 to 13 mm or less than 13 mm and more than 10 mm, then it is called relative stenosis, and if it is less than 10 mm, then it is called the absolute stenosis. Stenosis most commonly caused by the disc herniation. There is another criteria, that is the torque ratio or torque Pavlov index, a ratio of the spinal canal diameter to the vertebral body width. So as we can see in this X-ray, this is the ratio of spinal canal diameter. This is the red color A, and this is the vertebral body width. If it is more than 1, then it is normal. If it is less than 0.8, then it suggests the spinal canal stenosis. This is the MRI image, and we can see this is the vertebral body width and this is the spinal canal width. Vertebral body width must be more than that of this spinal canal width. Now some important ligaments of cervical region. So first one is the anterior longitudinal ligament, courses along the interior body of the cervical vertebra, and it extends from the base of the skull to the whole length of the spine, and superiorly at base of skull it forms the anterior atlanto-occipital membrane, which attaches with the clivus to the C1 vertebral anterior arch, and this both prevents the hyperextension of the vertebra. Now second one is the apical ligament. So we can see here, this is the apical ligament that attaches the apex of the dens with the foramen magnum, and it is a very weak stabilizer of dens. Third one is the alar ligament. The ligament attaches from the tip of the dens to the occipital condyle on either side. So this is the, and it limits the rotation. Fourth one is the cruciform ligament. So cruciform ligament is a transverse band, holds dens to the C1. So this holds dens to the C1 vertebra, and it prevents the anterior displacement of the dens. Another one is the posterior longitudinal ligament. This also courses along the whole length of the spine on the posterior surface of the vertebra or vertebral body. So superiorly it forms the tectorial membrane at the foramen magnum, and it attaches the clivus or skull base to the posterior longitudinal ligament, and it is a craniovertebral joint stabilizer. Now the posterior ligaments, ligamentum flavum. So ligamentum flavum lies in between the lamina, and it has the elastic property assist in the extension recoil. Now another one is the posterior atlanto-occipital membrane. It attaches the foramen magnum with the C1 posterior arch. So this limits the flexion. Another one is the supraspinous ligament, runs at the tip of the spinous processes, and in neck it forms the nuchal ligament, and these limits the flexion of the vertebra, and these nuchal ligaments extend to the occipital region. So these are all about the ligaments of cervical region. Now the neural foramina and nerve roots in cervical region. So neural foramina are the exiting pathway for the nerve roots, as we can see here. So these are the neural foramina, and these are located in between the pedicles, both superiorly and inferiorly pedicles, and these are the neural foramina. On axial section, it lies in between the anteriorly vertebral body and posteriorly the facet joints. So this is evaluated for the foraminal narrowing. This is denoted by in this image due to the disc protrusion or osteophyte. So we can see here in this image there is normal neural foramina, whereas in this bilateral narrowing and right side narrowing is noted. This is the sagittal image showing the pedicles. These are pedicles, and these structures are the neural foramina. We can see here there is narrowing of the neural foramina due to the disc herniation and the small osteophyte formation. Now the facet joints. So posteriorly located joint between the vertebra, it is formed by the superior and inferior articular processes. So these are the facet joints. These are the facet joints and best seen on axial images, and they help in the spinal stability. And in MRI, we look for the arthropathy or joint effusion. So we can see here there is a bone marrow edema of the facet joint. So this is the facet joint edema, and as well as the fluid within the facet joint, which appears bright on histo image and T2 image. Important landmarks and level for identification of cervical spine. C2 is dense. Here we can see. C6 is at cricoid cartilage level. C7 has the prominent spinous process. And always count vertebra very carefully on sagittal image, that is on MRI as well as on CT or X-ray. Now the common pathology correlations of cervical spine. So disc herniation. So focal protrusion of disc, cervical spondylosis. Disc herniation with osteophyte formation is called the cervical spondylosis. Canal stenosis, that is the reduced CSF space of spinal canal, and myelopathy, that is the cord signal changes. So here in this image we can see that this is the normal cord. There is no any compression, whereas in the second image we can see that the desiccated disc along with the disc space narrowing and spinal canal stenosis with also signal change in the spinal cord. So this is called the compressive myelopathy. This is all about the normal anatomy of cervical spine. So which MRI sequence do you find most difficult, sagittal or axial? Let me know below in comment section. Thank you.